So for 30 years, I have been living with Graves' disease and my symptoms of thyroid eye disease, or TED. And those symptoms are like bulging eyes, red eyes, dry, irritated eyes, to the point that when I slept, my eyes didn't close fully. And my problem was that no one ever told me that those symptoms, the eye symptoms, were separate from my Graves' disease and that they required separate treatment from a TED specialist like an oculoplastic surgeon or a neuro-ophthalmologist. And so I've been searching, once I was finally diagnosed, it was amazing for me to get my life back on track. And my thing now is I want other people to be aware of that too. One of the impacts for me is that I had to stop driving because the lights from the oncoming cars were blinding to me. And so these are things that, the symptoms present themselves differently in different people. Some people have watery eyes, they have double vision, and worst case scenarios, it could be blinding. So the goal is to know the risk, that if you have Graves' disease or a thyroid condition, that up to 40% of those people may develop TED. And so and then for women are actually 5 times more likely than men to develop it. We want you to understand that you're not alone, but also to know that you've got to pay attention to your eyes and find a TED specialist, which is like an oculoplastic surgeon or a neuro-ophthalmologist, so that you can get your life back on track sooner than later. Be your own best advocate.
For me, a lot of people know me as a Peloton instructor. What they didn't see was behind the scenes, the exhaustion and the toll that prior to my diagnosis, just the symptoms were having on me. About 5 years ago, my life and health were flipped upside down. I couldn't stay awake for more than about 4 hours without needing a nap. I was like a newborn baby. It felt like a heavy curtain was being pulled over my eyes, and I stopped doing all the things that I love to do. I searched for answers for a couple of different years with different doctors, not finding any, but being told regularly that my exhaustion was probably just because my job was physically demanding. Finally, after telling enough people that you're telling me I'm fine, but I am telling you that I'm not, I was able to find the right care team, get diagnosed with Hashimoto's disease, which is underactive thyroid autoimmune disease, and get the care that I needed. Well, with autoimmune conditions, the body attacks the healthy cells by mistake. With thyroid conditions, like we both have, the body attacks the thyroid. And with TED, thyroid eye disease, the body attacks the muscle and the tissues, the fatty tissues behind the eyes. So Gail has been diagnosed with thyroid eye disease and didn't know the symptoms because there wasn't this awareness that we're trying to create right now. And now, through my own diagnosis of Hashimoto's, or underactive thyroid, I found out that if you have a thyroid condition like us, but especially like you were saying with Graves, you're at a higher risk. But if you have a thyroid condition, you're also at risk for developing other autoimmune conditions like thyroid eye disease, or TED, a separate but related autoimmune condition that requires separate care.
Well, I'm going to tell you to be your own best advocate. That's the advice, and that you're not alone. Know the signs, know the symptoms, know that you're at a greater risk. And I call TED Ted, because he's been living with me for 30 years, so he needs a name. But you need to be prepared, and you need to have the care team. When I ran track, I had a full team, and the part that was missing was my TED specialist. And so there is an easy website that you can go to get that information, and it's focusonted.com.
And anyone can head there to learn more about the risk, signs, and symptoms of TED, or to find a TED specialist near you.